Namaste Bitya, Hamisha Khush Raho Bitya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this lecture, we are going to start with the locomotor system. The diseases of the locomotor system, the most commonly encountered diseases that we see in the locomotor system. So today, we are going to discuss about osteoarthritis. Osteoarthritis is one of the most common disease that we see in our day-to-day life. So let's start with osteoarthritis today. What is osteoarthritis? In this lecture, we are going to discuss about the clinical features, the definition of osteoarthritis, the etiopathogenesis, the clinical features, various investigations, and management of osteoarthritis. So let's start with osteoarthritis. Osteoarthritis, as we all know, is a disease of larger joints of the body. So basically, what is osteoarthritis? Osteoarthritis, it is a condition of the synovial joint that is characterized by three following features. The most important three following features of osteoarthritis includes focal loss of articular hyaline cartilage. We all know that in the joints, we have hyaline cartilage, and there is a focal or the local loss of the articular hyaline cartilage. There is proliferation of the new bone and the remodeling of the joint contour. So in osteoarthritis, we are going to see three changes. There is focal loss of the articular hyaline cartilage, there is proliferation of the new bone, and there is remodeling of the joint contour. The target of osteoarthritis are usually small and the larger joints. What happens in the joint is there is loss of articular hyaline cartilage, and there is breakdown of the hyaline cartilage with the formation or the proliferation of new bones at the margins. And also there is remodeling or the reshaping of the joint contour. So there are various things that we should know. In the pathophysiology, there are certain physical changes or the pathological changes that we are going to encounter in the joints. Osteoarthritis usually involves the larger joints of the body, like hip joint, like the knee joint, etc. Although smaller joints are also involved. So what we see in the joint, there is remodeling of the bone contour. There is fibrillation and the focal loss of the hyaline cartilage. So the most important thing that we have to remember is the focal loss of the hyaline cartilage that is to be remembered in case of osteoarthritis. There is marginal osteophytes or the ossification of the new fibrocartilage. There is also subchondral sclerosis, means hardening of the cartilage, the surface below the cartilage. And there are also secondary bursitis that we are going to see in case of osteoarthritis. Apart from this, there is capsular thickening, osteochondral body formation, and synovial hyperplasia. There is also secondary enthestopathy. So in the PPT or the e-notes that I have shared with you, I have also given you the pictures or the pictorial representation of the changes that you are going to see in case of osteoarthritis. You can also see the X-ray changes, especially the changes which includes secondary enthestopathy in the PPT or the e-notes that I have uploaded on the portal. Now, what is the prevalence? What is the prevalence, or what are the common sites or the common individuals who are going to suffer from osteoarthritis? So prevalence, it is uncommon, usually under the age of 40. So osteoarthritis is basically a disease of the older age individual. It is highly prevalent over the age of 60 years, and it is more common in women than in men. So old females, especially greater than 60 years of age, are more prone for development of osteoarthritis. I have also shown you the comparative X-rays of a normal knee joint and the knee joint of the affected individual. The affected individual will have bony spur and the narrow joint space due to the focal loss of the hyaline cartilage. This I have shown you in the PPT and the e-notes that I have shared with you. So go through that particular PPT and also go through the book for more details. Now, what are the typical characteristics of the pain that we are going to see in case of osteoarthritis. So whenever a patient of osteoarthritis is coming to us, what are the characteristics of pain that we are going to see? The age is usually greater than 60 years and it is not seen below the age of 40 years. The pain is usually insidious in onset, means slow, steady pain, and it occurs for months to years. There are variable and intermittent over the time. The pain is variable and intermittent over the time, and it is mainly related to the movement. The pain of osteoarthritis, let me again repeat it. It is usually insidious, slow onset, and it occurs over the months or years. There is variable or intermittent over the time, and it is mainly related to the movement. The pain is relieved by rest, and there is morning stiffness. So whenever the patient of osteoarthritis is rising, there is usually morning stiffness, and usually one or few joints are painful. So either one or few joints are painful in the individual. So in osteoarthritis, we are going to see the pain that is slow, insidious onset over the months or years. It is variable or intermittent over the time, and it is mainly related to the movement. It is relieved by rest, and there is morning stiffness that could be seen, and it usually occurs only a few or more painful joints are seen. Now, what are the risk factors? Risk factors for development of osteoarthritis. So there are two things or two factors that are responsible. Number one, there is constitutional susceptibility for development of osteoarthritis, and there are other mechanical factors. So constitutional susceptibility includes the heredity, the gender or hormonal status, there is obesity, high bone mineral density. Apart from this, there is aging. Aging is responsible for both constitutional susceptibility and the mechanical factors for development of osteoarthritis. In the mechanical factors, it includes trauma, any kind of injury. There is joint shape. If there is any deformity in the shape, it will be responsible for development of osteoarthritis in the later part of life. Alignment, usage. Usage includes occupational and recreational activities. So we have risk factors. Risk factors is classified into two parts. We have constitutional susceptibility and the mechanical factors. In the constitutional susceptibility, we have heredity, gender or hormonal status, obesity, and high bone mineral density. Mechanical factors includes trauma, joint space, joint shape alignment, usage. Usage includes occupational and recreational activities, and aging is common in both the conditions. Now, what are the clinical signs? The clinical signs that we are going to see in case of osteoarthritis. In the clinical signs, we will observe restricted movement of the individual. There will be restricted movement of the joints that are affected. There will be coarse crepitus due to rough articular surfaces. So there will be crepitation, loud crepitation due to the rough articular surfaces. A restricted movement with coarse crepitus due to rough articular surfaces. There will be bony swelling that is known as osteophyte around the joint margin, and there will be also deformity. There will be periarticular tenderness with muscle weakness and wasting. And there can be no or only mild synovitis. So I will again repeat the clinical signs. The clinical signs includes restricted movements, coarse crepitus due to the rough articular surfaces. There will be bony swelling, which include osteophytes around the joint margins, deformities, different type of deformities, periarticular tenderness, muscle weakness and wasting, and there can be no or mild synovitis. Now, I have also shown you the picture of the changes in case of osteoarthritis. So you must go through the PPT in order to see those changes. The changes are also shown in the pictorial form in the book, so you have to refer the book as well. Now, we come to the nodal generalized osteoarthritis. One of the variety of arthritis, osteoarthritis, is nodal generalized osteoarthritis. So what are the characteristics of nodal generalized osteoarthritis? There will be polyarticular finger interphalangeal joint osteoarthritis. So nodal, as the name suggests, nodal means involvement of the nodes, and generalized means involving the whole of the body. So there will be polyarticular finger interphalangeal joint osteoarthritis. There will be presence of Haberden's nodes and Bouchard's nodes. So because of the presence of Haberden's and Bouchard's node, it is also known as nodal generalized osteoarthritis. Although Haberden's and Bouchard's nodes we are going to discuss in case of rheumatoid arthritis in the next lecture. it is having marked female preponderance, means this disease is more prominent among the females, and the peak onset in the middle ages. So it is rarely seen in case of young adults, but more commonly seen in the old age individuals. There is good functional outcome for hand. There is predisposition to osteoarthritis at other joints, especially the knee joints. And there is also strong genetic predisposition. So let me revise the characteristics of nodal generalized osteoarthritis. It includes polyarticular finger interphalangeal joint osteoarthritis, presence of abundance of the Boucher's nodes, there is marked female preponderance, peak onset is middle age group, there is good functional outcome for hands. If hands are involved, then there is good functional outcome. There is predisposition to osteoarthritis at other joints, especially the knee joints, and there is strong genetic predisposition. Now, what are the causes of early onset osteoarthritis? Although osteoarthritis is common among the old age individuals and it is very rarely seen in young adults, but there are certain causes if it is seen in early age onset with osteoarthritis. So what are the different causes that we are going to see? The causes includes monoarticular, means whenever a single joint is involved, then single joint involvement in early onset osteoarthritis can be because of previous trauma, any kind of injury, or localized instability. If it is present in multiple joints, that is pauciarticular or polyarticular, it is due to prior joint disease, example, juvenile idiopathic arthritis, or it can be due to metabolic or endocrine diseases. It can also be due to spondyloepiphyseal dysplasia or late avascular necrosis. Other cause includes neuropathic joints and endemic osteoarthritis. So the causes includes for the early onset osteoarthritis is classified into two parts. One is monoarticular, when the single joint is involved, and pauciarticular, few joints, or polyarticular, multiple joints involved. So in case of monoarticular, there is history of previous trauma or localized instability. In pauciarticular or polyarticular, we have prior joint disease, example, juvenile idiopathic arthritis. There is metabolic or endocrine diseases, spondyloepiphyseal dysplasia, late avascular necrosis, neuropathic joints, and endemic osteoarthritis. Now, what are the various investigations that could be done in case of osteoarthritis? Whenever a patient of osteoarthritis is coming to us, what are the various investigations that we can go for? The most common investigation in case of osteoarthritis is the plain X-ray. So X-ray of the joint that is involved. You have to go for plain X-ray and you have to perform bilateral X-rays of both the joints with AP and lateral view. The full blood count, ESR and CRP are usually normal in osteoarthritis because it is a non-inflammatory disease. On the contrary, rheumatoid arthritis is an inflammatory disease. Therefore, the CRP and ESR will be raised in case of rheumatoid arthritis, but these are normal in case of osteoarthritis, the full blood count, ESR and CRP. You can also go for synovial fluid aspirate from the osteoarthritis knee that is predominantly viscous with low turbidity. So we can go for a plain X-ray, full blood count, ESR, CRP are usually normal, and synovial fluid aspirate from the osteoarthritis knee that is predominantly viscous with low turbidity. Now, how to manage a case of osteoarthritis? Whenever a patient of osteoarthritis is coming to us, how we can manage the particular patient? First of all, we have to give the full explanation of the condition. That is, we have to explain the patient what is this disease and how he or she can manage it. Then we have to advise proper exercise or the physiotherapy that could help in relieving the pain and suffering. We also have to do the reduction of adverse mechanical factors. We have discussed about the various mechanical factors that are responsible for development of osteoarthritis. So we have to reduce those adverse mechanical factors. There are various drugs available for the treatment of osteoarthritis. The drugs includes analgesics for pain and oral non-steroidal anti-inflammatory drugs for reducing the inflammation of the joint. And last of all, surgery. Surgery will include osteotomy and joint replacement. So the management consists of the following things: full explanation of the condition to the patient, exercise, reduction of the adverse mechanical factors, drug treatment, analgesics and non-oral NSAIDs, and surgery, which include osteotomy and the joint replacement. So this was all about the osteoarthritis. Let me have a quick review or the recap of osteoarthritis for you. Osteoarthritis is a condition of the synovial joint that is characterized by three things. Number one, focal loss of the hyaline cartilage, proliferation of the new bone, and remodeling of the joint contour. It usually affects the larger joints, sometimes the smaller joints. It is more common in old age, especially in the women, and it is rarely seen below the age of 40 years. So there is focal loss of hyaline cartilage. There is proliferation of the new bone, which is characterized by formation of osteophytes and remodeling of the joint contour. The various risk factors included constitutional susceptibility and mechanical factors. Constitutional susceptibility consists of heredity, gender, hormonal status, obesity, high bone mineral density, and aging. And mechanical factors included trauma, joint shape alignment, usage that included occupational and recreational activities. The clinical signs of osteoarthritis were restricted movement, coarse crepitus due to the rough articular surfaces, bony swelling or the osteophytes around the joint margin, deformity, periarticular tenderness, muscle weakness, wasting, and no or mild synovitis. Then we had discussed about the generalized nodal generalized osteoarthritis, which included polyarticular finger interphalangeal joint, Heberden's or Bouchard mode, marked female preponderance, peak incidence in the Middle Ages, good or functional outcome for the hands, predisposition to osteoarthritis at other joints, especially knee, strong genetic predisposition. Then we had also discussed about the causes for early onset osteoarthritis in both monoarticular joints, pauciarticular and polyarticular joints. So in the monoarticular joint, we had discussed about previous trauma and localized instability. In the pauciarticular and polyarticular joints, we had prior joint disease, which included juvenile idiopathic arthritis, metabolic or endocrine disease, spondyloepiphyseal dysplasia, late avascular necrosis, and neuropathic joints, and also endemic osteoarthritis. The various investigations that could be performed in case of osteoarthritis were plain X-ray, the ESR, CRP, and full blood count were normal because it is a non-inflammatory disease, and synovial fluid aspirate from the osteoarthritis knee is predominantly viscous with a low turbidity. The management of osteoarthritis included the full explanation of the condition for the patient, exercise, which include physiotherapy, reduction of the adverse mechanical factors that we have just discussed, drug treatment, analgesics or oral non-steroid anti-inflammatory drugs, and also surgery, which includes osteotomy and joint replacement. So this was all about osteoarthritis. In the next lecture, we are going to discuss about rheumatoid arthritis. So this was all about osteoarthritis that we had just discussed. We will be meeting in the next lecture with rheumatoid arthritis. As we all know, as I have already discussed, osteoarthritis is basically a non-inflammatory disease, whereas rheumatoid arthritis will be a inflammatory disease. So this was all about osteoarthritis. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope this session is clear to you. If you have any comment, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.